This is Dr. John Odette. Today we will be discussing a Morgagnian cataract or pseudo-Morgagnian cataract. The eye has already been injected with vision blue and the capsule stained. You will see we inject a generous amount of viscoelastic to pressurize the anterior chamber. On entering the anterior capsule with the cystotome, we make a small little puncture wound, and you will see that it appears that there is almost a Argentinian flag sign going on, but in fact this is a plume of cortical material. When we enter the eye with the 27 gauge cannula, much of this plume immediately comes out. However, it does obscure our view of the capsule some, so we inject more viscoelastic, as you see here. We then had to go back in and figure out where that initial puncture wound was made into the capsule with the cystotome. Once again, when we start to reopen that, more cortical material starts to flow out of that puncture wound. You can see it almost looks like a plume of smoke coming out of the cataract. Advancing along, you see this plume creates a pseudo effect here. We are going to go in and decompress this lens with a 27 gauge cannula. Right there you can see that we remove a significant portion of the cortex, and you see that the lens at approximately 10 o'clock, you can see the edge of the lens where the majority of that cortical material has been removed. It was practically all liquefied. We then feel it is safe to enter with a Utrata forceps to complete our continuous curvilinear capsulorhexis, which is done. This capsulorhexis was made small on purpose in case we needed to place a sulcus lens with optic capture. As you will see here, we are going to do a simple hydrodissection, but the lens is so freely mobile with a significant amount of space around it now that the cortex has been removed that it's just floating in the capsule. This was a extremely dense lens, and we used kind of a chip and a flip and chip technique with a chopper to break this into pieces. This is one of the most dense lenses I have ever chopped. It took quite a bit of force just to chop through this lens, but we chopped it into many small pieces and were able to subsequently phacoemulsify the remainder of the lens, and the entirety of the lens was removed from the eye. There was no capsular damage during this process. You can see here I'm using my chopper to essentially feed the nucleus into the phaco handpiece, almost like we would with a IA and a second instrument. It worked quite well. The cornea was very stable following the case. A three-piece lens was placed in the bag, and the patient did very well post-operatively. Thank you very much for observing this case.